On this Friday night, hospitals at a breaking point.
It is the most busy we've ever been.
The perilous mission to move fragile patients to other facilities. Rising cases, rising travel restrictions. What needs to happen to relax rules this summer? Plus, the new group of Canadians now eligible for the AstraZeneca shot, as Canada reports a new blood clot case. And recycled rocket.
Godspeed, endeavor, and cruise.
The Space and Sustainability Mission.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. Ontario's healthcare system is being crushed under the weight of an unrelenting third wave. Hospitals and ICUs have reached a breaking point. There are more than 2,200 people in hospital, including 818 in intensive care. That's a new record in Ontario, and it's pushing stretched resources to the brink. Out of sheer desperation, critically ill patients in COVID hotspots are now being transferred to make room for more. It is the most severe phase of the pandemic yet, and the pressure is mounting. In our top story tonight, Jeff Semple gives us a rare look at how the province is managing critical care and the tough choices that lie ahead.
Multiple times a day, staff at this Toronto hospital now perform a delicate dance. This woman in her early 60s tested positive for COVID-19 a few days ago. Struggling to breathe, she had to be intubated. This ventilator, a breathing machine, is keeping her alive. But now she has to move.
Our ICU now is currently completely full.
The hospital's intensive care unit, home to the sickest patients, is overwhelmed. They've even built makeshift ICU additions with extra beds in other areas of the hospital, but they simply don't have enough staff.
There's a profound shortage of ICU nurses.
So they worked the phones, calling other hospitals in the region. And they found one in the small community of Orillia, about a 90 minutes drive north, which has agreed to accept the patient. The challenge is getting her there. Ornge is an Ontario non-profit that provides air ambulance rescue and medical transportation services. They've been shuttling patients to hospitals for more than 40 years, but they've never experienced anything like the past couple of weeks.
There's nothing we can compare it to. It is the most busy we've ever been.
More than 1,200 COVID-19 patients have been transferred so far this year, nearly half of those coming in just the month of April. They rely on a small fleet of ambulances, a dozen helicopters, and they've just borrowed some buses equipped to carry 2 COVID-19 patients at a time.
They have portable machines and they have portable monitors, so everything is miniaturized to be able to do that.
This bus is transporting a couple of COVID patients from the Toronto area to another hospital 3 hours away in Kingston.
So right now, a lot of this accelerated transfers has been to try to get as many people out of the GTA as possible to fill up places like Kingston and those outside.
But as a result, Kingston is now filling up and moving some of its patients to Ottawa, while others head to different smaller communities across the province.
Is there an element of risk in moving some of these patients?
There's always risk, even just going from here in the hospital if you were to go from one floor to the next floor.
But so far, no COVID patients have died in transit. Hospital staff say they only move those who are in stable condition, and they no longer require the family's consent.
And that's the hard part. And unfortunately, we're in a system where we often have no choice because otherwise we would not be able to support everybody.
Jeff Semple, Global News, Toronto.
The situation in Alberta is growing more serious by the day. Almost 1,700 new cases were reported today. More contagious variants are driving the rapid spread, and doctors are warning Albertans could be in for a crisis similar to hard-hit Ontario. But as Heather Yourex-West reports, Jason Kenney's government still has no plans to toughen up restrictions.
For those born between 1967 and 1981, this week brought new hope. After becoming eligible for the AstraZeneca vaccine, Gen Xers flooded social media with selfies, adding in a healthy dose of nostalgia, too.
I'm pro-vaccine selfie. It's a way that we can normalize vaccination for people who might be a little bit hesitant, who might be a little bit concerned.
But beyond the immunization rollout, Alberta's COVID situation is bleak. Daily infection numbers have now climbed to highs not seen since the peak of Alberta's second wave, leaving doctors to brace for the weeks ahead.
I have friends that are working in Ontario. General internists, colleagues in the intensive care units are sending out distress signals. That's going to happen here.
We're looking at where those cases are and where the spread is happening.
Alberta's health minister blames the province's current spike on gatherings over the Easter weekend. But the government is still hoping restrictions announced 2 weeks ago will be enough to turn things around. This week, because of a Moderna shipment delay, a mobile vaccine clinic planned for workers at the High River Cargill meat packing plant, the place where more than 900 workers fell ill last year, had to be postponed, highlighting that beyond the sea of vaccine selfies, many essential workers are still vulnerable.
Every one of us that have had to palliate a family member on a FaceTime, Zoom, I mean, that leaves scars. I don't know how to tell people that other people matter. That's going to happen.
A nightmare already playing out in one part of Canada appears primed and ready to start playing out here as well. Heather Yourex-West, Global News, Calgary.
There is some promising news about Canada's trajectory. New federal modeling shows stricter public health measures have helped slow the surge. For the first time in many weeks, the national RT value has dipped below 1. That number tells us how many people a single infected person gives the virus to. If it stays consistently below 1, the spread of the disease is slowing. Now that more people are getting vaccinated, Canada's top doctor says it may be safe to lift restrictions this summer.
These models give us hope, illustrating that there is a safe way to lift most restrictive public health measures by this summer if enough people get vaccinated.
The key point there is that enough people must be vaccinated. As of today, 27.5% of the population has received at least one dose. Only 2.6% has been fully vaccinated with both doses, something that could help speed up vaccinations. The National Advisory Council on Immunization is now recommending AstraZeneca be offered to Canadians 30 and up. Tonight, Abigail Bimman reports on where Canada's rollout needs to be for restrictions to ease, and why combating vaccine hesitancy will be crucial.
Are you excited?
Yeah, I am very excited.
Justin Trudeau's first shot. His wife Sophie got hers too. She didn't need her hand held. Getting the AstraZeneca vaccine is a shot in the arm for the government's tagline that the best vaccine is the one you can get, undermined an hour later by the country's National Advisory Committee on Immunization.
NACI recommends that the AstraZeneca COVID-19 vaccine may be offered to individuals 30 years of age and older without contraindications if the individual does not wish to wait for an mRNA vaccine and the benefits outweigh the risk.
Yet again, changing advice from NACI, acknowledging some people want to wait, and they seem to suggest with good reason.
NACI continues to preferentially recommend authorized mRNA COVID-19 vaccines.
I don't think we should be vaccine shopping at all if we're going to get the vaccine, especially if we have an underlying medical condition.
Dr. Neil Rao says the perception AstraZeneca is an economy-class vaccine compared to first-class mRNA is unfortunate.
Having too much information sometimes can be very challenging for people to understand, and it could lead to vaccine hesitancy.
That's a speed bump on the road to normalcy. We just don't know exactly how big it is.
That large part of the population that may be sitting on the fence or maybe is a bit hesitant, you can see what the difference is.
The country's top doctors presented a new type of slide Friday, for the first time showing the conditions under which restrictions could be lifted this summer without overwhelming hospitals. 20% of Canadians would need their second shot and 75% their first.
At this point, restrictive measures could be gradually eased as long as adequate test, trace, isolate capacity, and individual precautions are maintained.
But the modeling shows hospitals will be overwhelmed even if that first dose coverage drops to 55% of Canadians. And of course, the other piece of the puzzle is supply. Ontario and Alberta have already said they won't give AstraZeneca to people in their 30s simply because they don't have enough. Abigail Bimman, Global News, Ottawa.
Ontario has reported its first case of extremely rare blood clots linked to the AstraZeneca COVID vaccine. The province says the case involves a man in his 60s. He is now recovering at home. This is the fourth case of a blood clot in Canada out of more than 1.1 million COVID doses administered. Health Canada insists the benefits outweigh the risks. Pregnant women are now eligible for COVID-19 vaccines in Ontario. The province moved the group up the priority list after seeing growing evidence that pregnant women are at increased risk of severe illness. The Society of Obstetricians and Gynecologists of Canada has called on all provinces to prioritize pregnant women. New Brunswick made the move earlier this week. New Brunswick is now imposing tougher measures after detecting multiple cases related to travel. Starting tomorrow, non-essential travelers, some business travelers, and people moving to New Brunswick must isolate for at least 7 days at a designated hotel at their own expense. People who don't need to enter the province are being told to stay away.
Right now, if you don't need to come to New Brunswick, don't come here. We want you. Just not right now.
Next door in Nova Scotia, a near total lockdown is now in effect in the Halifax region. For days, cases have been rising. Today, the province reported 44 new infections. That's the biggest daily jump in a year. The BC government has revealed details of its clampdown on non-essential travel effective immediately. The order restricts movement for recreational purposes across 3 regional zones. It's still okay to travel for things like school, work, and health care. Periodic road checks will be in place at key corridors to discourage non-essential travel. Those who break the rules could face a $575 fine. The changes are in effect until May 25th. There are stunning developments in our ongoing coverage of sexual misconduct allegations in the military. At a parliamentary committee looking into the accusations, Major Kelly Brennan delivered bombshell testimony against former Chief of the Defence Staff, General Jonathan Vance. Now, a former key aide to the Prime Minister is shedding light on what Justin Trudeau's office knew about the allegations. David Aiken reports.
30-year Army veteran Major Kelly Brennan spent 2 full days being interrogated by military investigators. And she told MPs Thursday that General Jonathan Vance told her what to tell them.
Definitely, he gave me very many consequences if I was not following his orders.
She said there were no threats of bodily harm, but she also testified that Vance, who had just retired as Chief of the Defence Staff, or CDS, was not worried about the consequences of his actions.
The CDS told me he was untouchable.
Nor was Vance worried about his civilian bosses, like the Defense Minister, Harjit Sajjan.
General Vance always told me that he always had them under control.
Brennan also told the committee that Vance fathered 2 children with her. Global News spoke with Vance in February, and at that time, he denied all allegations of sexual misconduct, and he also denied having fathered children with Brennan. The military investigation into Vance's alleged misconduct continues. Meanwhile, the political fallout escalated. Elder Marquez, a former top political aide in the Prime Minister's office, testified Friday that back in 2018, Trudeau's Chief of Staff, Katie Telford, knew about an allegation of potential misconduct by Vance, and that Marquez kept her informed of developments.
The important, sensitive, and unusual nature of this matter was immediately obvious to me, even in the absence of any details regarding the allegation.
It is the first time anyone has confirmed that Telford, Trudeau's closest, highest-ranking, and longest-serving political advisor, was in the loop. And yet, neither Trudeau nor Sajjan acted on the allegations. Instead, they extended Vance's tenure as Canada's top general and gave him a raise. Telford, in a statement Friday, repeated what Sajjan and Trudeau have said all along, that the appropriate steps were taken at the time, but that improvements to the system are in the works.
There are, of course, lots of things we need to add to and create better processes for, but that is something we continue to work on.
David Aiken, Global News, Ottawa.
It's the vessel that vanished in deep waters. Coming up, why search crews only have a few hours left to find those on board.
And liftoff. Godspeed, Endeavour and Crew 2.
Space and sustainability are connecting on the final frontier. SpaceX and NASA successfully launched 4 astronauts into orbit early this morning using a recycled Falcon 9 rocket and a reused Dragon capsule. Crew 2 will arrive at the International Space Station on Saturday and will spend the next 6 months at the lab before heading back to Earth inside the same spacecraft that got them there. Time is running out to find a missing Indonesian submarine which disappeared off the coast of Bali on Wednesday. The sub now has less than a day's supply of oxygen for the 53 people on board, and there are fears the vessel may have sunk so deep that it won't be able to handle the pressure. Indonesia's Navy believes an electrical failure caused the sub to lose control during a training exercise. Still ahead, those blue skies over Alberta are producing a green boom. Alberta is set to lead the country in the growth of wind and solar resources, according to Canada's energy regulator. And as far as NASA reports, displaced workers in the oil and gas sector are counting on the green side of the energy sector.
Like many Albertans, Drew Mair's career has been shaped in the boom and bust of oil and gas. But in the bust of 2015, he took a chance.
And then I decided it was time for a change.
An electrician by trade, he turned his skills to a new form of energy, solar.
It's just such a underutilized resource that, shines, especially in Alberta.
Mair charted a new course, started his own company. It was slow at first, but now
I'm swamped.
Business is booming. His team is paneling roof after roof with no bust in sight. Across oil country, a construction boom with new projects of staggering scale, propelled by sunny market conditions.
We're the sunshine state of the north.
Greengate Power is developing this immense project that'll power more than 100,000 homes and employ 500 in its construction.
We have a lot of skilled labor here in Alberta. I believe a lot of those skills are easily transferable to renewable energy projects.
The boom is due in part to the sliding dominance of fossil fuels, especially the drive to phase out coal. Canada's energy regulator forecasts the province's wind power capacity will double by 2023, and solar will soar many times higher.
It is a really remarkable thing how quickly costs have fallen for wind and solar over the last number of years.
About 7 years ago, my predecessors.
Here on the Montana First Nation in Maskwatchis, under the leadership of Chief Leonard Standing on the road, Drew Mair now oversees the largest solar farm on Indigenous land in Canada.
We can do it because it's coming into play and just the right timing.
Perfect timing. The farm just went online last October.
And when that thing got activated, it cut our power in half, so we knew that we were onto something.
It's a shining source of pride here, where wealth was once grounded in oil until the wells went dry. Since then, Montana has made the shift one by one. Key buildings were arrayed with solar of their own, and all feeding the grid through Montana's own renewable energy company. And for young people here, a future in a resource that will never run out.
Oh, it's made a big difference in our attitude of our nation members, that they're really looking at it as an opportunity for careers.
For Mair, Montana is an inspiration wherever there's wind and sun.
It just goes to show that even though Montana is a small nation, with the right people in place and the right desire, you can accomplish these types of projects.
Farah Nasser, Global News, Toronto.
With the third wave comes a career crisis. Up next, why some healthcare workers are ready to quit. For more than a year, healthcare workers have endured long, stressful shifts to care for patients suffering with COVID-19. They're exhausted, burnt out, and in some cases struggling with post-traumatic stress. Now this third and most threatening wave is upon them. As Krista Hesse explains, many are rethinking their careers and making a difficult choice.
So just finishing up shift today on the COVID unit. We're starting to see our hospitalizations climb steadily.
Dr. Nisha Bakshi is the internal medicine lead at the Royal Alexandra Hospital in Edmonton. She's also in charge of the hospital's COVID response. Dr. Bakshi says these days it's been hard to fill shifts on the COVID ward.
Everybody's tired of it. It's exhausting to work on the COVID unit.
It's a grim reality as Canada fights the third wave of the pandemic. ICU beds are full, patients are younger and sicker, and it's taking a toll on healthcare workers. Dr. Bakshi actually holds the record for the most days spent on the COVID ward at her hospital. But she says it's come at a cost. In January, she was diagnosed with post-traumatic stress disorder, or PTSD.
I noticed that I was having difficulty sleeping. I was having a lot of nightmares. I was reliving and replaying conversations I had with families.
She got help, and now hopes others in the medical field will do the same.
None of what we went through was normal. We all showed up and did our jobs, but we're not okay, and it's okay to say that.
Close to 70% of all healthcare workers reported worsening mental health during the pandemic, according to Statistics Canada. Psychologist Melanie Jones provides counseling for healthcare workers. She says a lot of her clients are exhausted and burnt out.
People are looking at this and saying, I have nothing else to give.
Just as hospitals race to increase their capacity, some in the healthcare field are walking away from the profession they love or are considering it.
You could create 5,000 physical beds, but if we don't have the right skilled staff, we will quickly get overwhelmed.
How worried are you about hospitals' capacity to treat people during the third wave and into the future?
Acutely right now, I'm very worried. So I think we're going to have a challenge with people, with just enough people to run the show.
Krista Hesse, Global News, Toronto.
For more on the wave of COVID fatigue hitting Canadian healthcare, you can watch The New Reality with Donna Friesen tomorrow night at 7, right here on Global. So many healthcare workers are going above and beyond right now, including nurse Amy Lynn in Ottawa. She was just transferred to a struggling ICU and brought along her guitar to raise spirits. So we leave you tonight with more of her serenade to patients. Thank you for watching, and I hope to see you back here tomorrow. Good night.